then I'm going to invite Sharon up here to kick us off since we've started. And thanks everybody online. Thanks for the patience.
Well, good afternoon, everybody, and welcome. We have a nice group between everybody that's in the room and everybody that's online. So nice turnout, and we welcome all of you. I'm Sharon Longhurst-Pritt, and I am the Director of the Clarksville County Department of Human Services with West Mountain Regional Healthcare Alliance. I am the Vice Chair on our board. So I'm just here to invite you on October 16th to come to our 10th anniversary from 4 to 6 at Hotel Colorado. We're going to be celebrating our 10 years of just being in existence and being here to kind of be the safety net. And, you know, I consider our organization to be kind of the glue that, you know, that brings all of our efforts together within our 3-county region. And so we're entering some tough times, you know, here in the near future as we watch the big bill pass. And there's just going to be a lot of challenges that come up as we face the next few years and head into these times of kind of the unknown. And so I think it's even that much more important for our organization to take a lead in bringing all of our 3 counties together and cooperating and collaborating as best we can as the resources that we have to lean into get a little bit more scarce, and we have to lean into other areas outside maybe governmental assistance as we had in the past. And so I think it lends itself very nicely to the panel that we'll have this morning to just talk a little bit about that. And hopefully we can have some engagement from our audience too in relationship to what they see the impacts will be with their different, different entities that they're representing also. And so did I miss anything, Christina? Are we good to go and kick off? All right, so enjoy lunch and welcome.
Thanks, Sharon. And also, if anybody, we do have translation available. So if anyone in the room or online would like to, in Spanish and English, you can select the button that it's a translation. It looks like a little world, and then you can select the language that you would like. Awesome. Just wanted to let you know. And David, thanks for translating. All right. I'm going to call up my panel, and we'll call you up to the front of the room. Testing. Hello? That works too. Either way. Yeah. Well, thanks everybody for being here. I sort of feel a little full circle because the first quarterly meeting I ever did too long ago was here at Valley View, and now I think this is my 30th quarterly meeting, if I did the math right. So I've been here over 8 years, so that's pretty exciting. But I'm really excited to welcome our panelists today. And I'm going to ask each of them to introduce themselves and kind of share briefly what brought them to this work. So Hans, I'm going to start with you.
Thanks, Christina. Pleasure being here with everybody. Interesting times for sure, as Sharon mentioned. And so anyways, it'll be an interesting day for a discussion around all of the things that are happening right now nationally. But my name is Hans Luckring, and I'm the Regional Outreach Director for Health Solutions West. We are the Community Mental Health Center here on the Western Slope. I swore that I was not going to become a social worker, and I swore I was not going to follow in my father's footsteps, but things just have a funny way of steering you to maybe what you're called to do. So yeah, that's maybe like the opposite of like what got me into the work, just watching how stressful and how much energy it took to be a social worker, watching my father, but yeah, there you go.
And I actually know his dad because I used to work with him. Great guy, great social worker. I'm Becca Schickling. I'm the Quality and Risk Director at Grand River Health, and I've been doing this kind of work for probably close to 20 years. I had a different career prior to that, but came into healthcare because I had a great experience with the birth of my daughter at Valley View. So I worked at Valley View first, and now I'm over at Grand River, a little closer to home, but really have enjoyed working in the healthcare environment, and I'm pleased to be here.
Hey everybody, I'm Stacy Gavrell. I'm the Chief Community Relations Officer here at Valley View. So excited to welcome you guys here and thrilled to be partnering to host the meeting and bring Christina back. So I've been here since 2009, and I guess what brought me here, I never had a direct path into healthcare, but I've always just been super passionate about making the world a better place. Perhaps that's a little idealistic, but there is no doubt in my mind that every day that I show up here at Valley View, I'm getting to do that with amazing people. And so it's just fantastic to be part of this team here at Valley View, but also the partnerships and the relationships across the community.
Afternoon. My name is Logan Hood. I'm the Executive Director for Community Health Services. We're a nonprofit safety net clinic based in Aspen. I've been in this role for almost 5 years, but I've been in healthcare since I started my nonprofit career around 18 or 19. My grandmother was diagnosed with breast cancer, and I was involved with the local affiliate of Susan G. Komen, and quickly somehow became their development person and then later their director, and kind of continued in the nonprofit sector since then, primarily in women's health and family access to health. So that's kind of where I started, and I'm so grateful to be here. Thanks, everyone.
Good afternoon. I'm Dustin Moyer. I'm a patient and CEO at Mountain Family Health Centers. I've been in the role for 1.5 years now, but was on the board for a couple years prior. My pathway to this role, my career trajectory was largely in health policy and health philanthropy, with the kind of through line that the work that I was doing was expanding access to healthcare. One of the personal beliefs that I have is that everyone should have access to healthcare. And I thought, what better way to do it than to lead an organization that exists for that mission?
Is it on? Okay. My name is Samantha, and I work with Lift Up. I'm the Director of Programmatic Operations, and I've been here for 4 years. And I started with Lift Up basically because I was a guest before. So I was in need of food and then saw what they were doing, and yeah.
Thank you. It's pretty awesome just to hear what brought everyone to this field, because it's not an easy field. I myself have been in health and human service nonprofits for over 20 years. And again, it's a good field. All of you in here are doing great work, and I want to emphasize that. Okay, let me grab my questions because I forgot them. All right, so I'd love to hear from each of you. I want to start on a positive note. Yes, there is a lot going on, but what do you consider your key successes of your organization and your work? And maybe we can pass this halfway and then the other one halfway.
All right, here we go. I was telling Christina we should start a karaoke session at some point. So stay tuned. Thanks for starting on a positive note. I think among all of the organizations represented here, we have a lot to celebrate, and we could not be doing it alone. So kind of just that high level sentiment I want to first convey. I think for Valley View, we've been serving the community since 1955, and we started as a little hospital in what I understand to be the outskirts of Glenwood Springs. And as you all know, we're kind of in the middle of it now, and we have a huge hospital with advanced specialty care. We have locations across the community. And so I think that evolution to be a regional healthcare provider is absolutely a success. And then I think for our community members, providing access to care from a primary care perspective, but also just bringing in advanced specialty care. So when someone's facing a daunting diagnosis, for example, cancer, heart condition, we just have grown a remarkable team of specialists so people can access that care close to home. And then I think my third point in terms of our overall success is just our people. We have an amazing team of staff. Our medical staff has grown significantly, and I think that has made a remarkable impact in not only where we are today, but the resiliency we have now looking forward in these uncertain times. So that's where we are.
Thank you. Community Health Services actually started in 1971 as a home visiting nurse organization in the Upper Valley. So we were doing primary care, child well visits, senior services, everything, really the gamut, and really ended up being the public health department for Pickens County up until 2016, where now there's a board of health and then a public health department, but we're contracted to do a lot of those public health services, including communicable disease and preventive programs like immunizations and prenatal care. Some of the successes over those decades were really expanding some of our care based on the community needs. For example, in the mid-'80s, a lot of folks were showing up to Aspen Valley Health without any prenatal care to the ER. So we really, with partnerships, intervened and created a great program that still consists today for Medicaid folks who need prenatal care. And so that program still continues at Aspen Valley Health. And in addition to that, we added oral health throughout the years when an organization, the Aspen to Parachute Dental Health Alliance, nod to Christina, was transitioning. And so if we didn't take on that program to be in the schools from Aspen to Parachute, over 2,500 kids K through 8th wouldn't have oral hygiene care for preventive services. So I think those are just two successes I can think of in our over 50 years. But really, I think what's successful, we've overcome pandemics and politics, and we're still a small but mighty health safety net clinic that's still around based on the need to fill the community gaps.
When I think about the past 18 months that I've been in the role, there's a lot to be proud of. I think what I would like to draw attention to are three things. First is just the resilience of our organization. When I came in, this was during the Medicaid unwinds, which required the state to reaffirm everyone's Medicaid eligibility. We learned that the state didn't really have the infrastructure to do that well. And at Mountain Family, about 2,000 of our patients lost Medicaid coverage, which resulted in about $1.5 million revenue loss for us. But despite that, and some of the difficult decisions that we had to make over the past year, we served about 3,000 more patients than we did the prior year. So we had about 17,000 patients last year. So we're really proud of that. I think the other factor I want to talk about is the people at Mountain Family. You don't go into community health to get rich, but you're drawn by the mission. And I think I see that every day. We have the lowest turnover in place since I've been there. And when we walk through our clinics, you can just see the passion for the work and the commitment to the community that our folks come to work every day for. And then the last thing I want to highlight is community partnerships. We are somewhat unique in community health centers with the dynamics of the communities that we're serving. We have a much higher rate of uninsured patients than most of the other community health centers across the state. That's largely driven by the cost of living out here. So at Mountain Family, in the last 12 months, about 48% of our patient visits were for uninsured patients. And so we can't do this work without Valley Views, the Bell Health, and the Aspen Valley Hospitals. And so, and too many other partnerships to mention, but that's been a priority of mine since I've been in this place, to just make sure that people understand the value of the work that we're doing and can see themselves in our success. So I'm really proud of the community partnerships we have in place as well.
So for Lift Up, I know that we've been open for over 40 years. And I think the biggest success that I think of is in 2022, we served 55,000 people. And then last year in 2024, we served over 190,000 and through various different programs. So.
Yeah, you guys can pass.
So I think one of the strengths of Grand River is our cultures and our partnerships. I mean, we have a very strong community support, kind of like Valley View. We've been around since the 60s as far as the hospital goes, and we have very strong support from our community to support having an individual hospital in Rifle. And I think one of the things that has made us so successful in the last few years is just we have these very strong partnerships. We've been working great with Valley View to make sure that we have coverage for many services that you don't normally see in small rural hospitals. So like we have visiting urology and cardiology, but we also have cardiopulmonary. We work very closely with Dr. Kilnani and pulmonary services. So we have a strong ortho department. We just have a lot of services that work for our community and keep care locally, which is very important to our constituents.
I was gonna lead with some kind of cat 9 lives analogy as far as some of the successes that are applicable, particularly to my organization. But I'm gonna steer away from that a little bit, specifically because we are part of a larger health system now that has been around for over 60 years, providing community mental health in rural Colorado. Just recently becoming part of the Health Solutions system. We are officially Health Solutions West, sister organization to Health Solutions South out of Pueblo, Colorado. I would say certainly one of the most successful aspects of our organization, one of our greatest strengths is our human beings. That is what Health Solutions has invested in. To be quite honest, we are not Mind Springs rebadged. We are Health Solutions, which is philosophically different about how we approach everything that we're doing. I think that I've not been this confident about our future, despite all the uncertainty that's happening right now, just because we have, again, some really amazing new human beings that are helping lead our team and communities into the future. And I think understanding how we're going to achieve that is through creativity, best practices, being nimble, and understanding, that we can't do everything, but there's a lot of opportunity in innovating around how we serve our communities. So, yeah, stay tuned.
Thank you, everybody. I always like to start with successes because we do have a lot of amazing successes in our community. We do work collaboratively. We work regionally. I'm happy to say that West Mountain works with everybody on the panel in some way, and also all of you in the room. And so I think it's just so important right now when we are navigating a lot of uncertainty and changes within our health system. So speaking of that, with funding cuts, Medicaid and SNAP significant changes, what do you think are the biggest challenges facing your organization and the region going forward?
I'll start since I went last time. I think a little bit of a dovetail on what I said was some of our strengths and successes. I think that we are going to be challenged about how we do what we have done for a long time and kind of get out of maybe some of the rigidity or just some of the siloing of thinking this is how we've done things for so long and this is how we have to do things in the future. I think we all understand that we're going to be facing some unique funding challenges. So I think it's going to be looking at partnerships. I think that that's going to be probably a common theme from the panel today. Really also talking about how we can make sure that we are resilient. And I think that that is going to be avoiding duplication, but also thinking about new ways of approaching how we do what we do. Getting out of, from our standpoint, getting away from just thinking traditionally about how people come into our services and really revamping how our community accesses our services. That will be happening over the course of the next 90 days, but that's a massive change, getting away from having people set appointments and really to everyone in the room is going to be referring to the Community Mental Health Center, which is Health Solutions West now, is going to be just an open access approach to it. That is not happening yet, but in the coming months, we will be rolling that out where you're basically going to be telling your clients that we're going to be partnering on just to show up. And we're going to just completely overhaul the way that we approach access for our communities that we serve, but also really thinking about innovating those partnerships around working together and getting out of that silo.
So I think it is going to be difficult because we really don't know what's going to happen. We don't know of the true impacts of what's coming. But I think if we stand by the principles of like what we do in healthcare is that we treat everybody who walks in our door and we just look at them as that person who's needing care and help. But I think also kind of moving forward and really pushing population health is going to probably hopefully be key for us to make sure that we can prevent those diseases from progressing and maybe treat them more proactively, hopefully. I mean, we are taking a lot of initiatives to do that and just, I think, maybe keep going forward in that direction.
Yeah, I think the theme of partnerships is absolutely key. Not only in terms of deepening those partnerships, but how we continue to innovate and be even more creative with them. Whether it's us here on the panel working together, the larger West Mountain panel looking for new partnerships, perhaps from the private sector, how can we continue to innovate and evolve from that perspective? I will say from a Valley View kind of insight into how we're looking at the recent legislation, yes, it's scary and daunting, but we have absolutely no plans to change any service, to change any programs. I had someone panicked come up to me in the grocery store because that's how our community is, wondering about change here. And I think it's reflective of not so much not acknowledging what is coming, but just knowing we're going to be resilient and creative and we're going to work to figure it out. And again, it gets back to people at all levels of the organization and in this community willing to lean in even more than they perhaps have been to weather this. And this is not something that's a light that's going to be turned on tomorrow or even next month. If you look at the rollout for some of these policy changes, we have a couple of years and who knows what will happen in the next couple of years. So there's still a lot that could happen, but I also think it goes back to the need to be creative, to continue to be flexible. But more than ever, I think I would want our community to know that we need them accessing the care they need. We need them to come to Valley View, to Grand River, Mountain Valley, all of these great organizations that are in our community to get the care that they need, because we do not want to acknowledge the fact that people need, whether it's primary care or an emergency department visit. And so I think that's something that we could do as this community just to make sure that that message is clear.
Coming from a nonprofit perspective, it's a little bit more real for us right now. We've already experienced some deep cuts to funding as of July 1st. Planned Parenthood, who we are a partner with, they're based in Glenwood, who do many of the similar programs, called me last week and said, effective July 4th, we're no longer allowed for the next year to see Medicaid patients. And that's beyond abortions. We're talking just preventive women's cancer screenings. So she called me, she called Dustin and some other partners to say, be prepared. You might be having an influx of folks since you are one of the few that take Medicaid. So that already is looming and happening. And then last week, I think it was Thursday, Health and Human Services rescinded a policy from 1998 that rescinds undocumented access to federal health benefits, such as Head Start, mental health, and federally qualified health centers, community health centers, and programs like mine, like that take federal dollars for Title X, which is contraceptive services and cancer screenings. So that maybe I might not be allowed to serve patients because my funding is tied to federal dollars. And so those are things I'm just, prepared, I think, because we've been, at least my board and some staff have been in a process of scenario planning since March when the first cut was made. Really to prepare ourselves to have a plan and give me a roadmap as a director of how to navigate, or if there are deeper cuts, what do I do? Do I pull on our endowment? The last thing though I can tell you, like many of us up here, do not want to impact our programs. That's the last resort, but we don't want to have any surprises either. We want to be prepared and lean on partners and be ready so that there isn't a disruption. In addition to that, we're seeing our patients who have been with us for many years, who come back year after year, who have a trust with our providers, kind of delaying their care. They're concerned, they're calling, they're asking, and we're just trying to get the word out to say, no, we're still here. We're still a safe place, and continue to seek your care. But I think that's going to take some time. I wrote down to the answer of this question, I said, I think this is significantly going to roll back and fundamentally reshape access to health coverage and care in the United States. Hopefully we're a leader in the sector and in our state. We're lucky to be in Colorado, but we have, I think, an uphill battle.
So I think past 18 months have had their own challenges, and I think they all pale in comparison to what we're seeing today as a result of both federal legislation and executive branch actions. I want to pause really briefly on the HHS directive that Logan mentioned, because I think this is an existential policy that could impact not only the healthcare providers in our communities, but the entire community that we're a part of. For the longest time, at least for the last 25 years, community health, Head Start, Title X were seen as community benefits. And so they were largely exempt from the prohibition on people without documentation accessing that. We, as part of our mission, serve everyone that comes through our doors, regardless of their ability to pay, insurance coverage, documentation status. That's core to who we are. This new directive that came out last week says that we can't do that. And that's terrifying. I don't know exactly what it will take, what form it will take. We're still awaiting further guidance from HRSA, but the intent of this executive order and then the HHS directive is to restrict access to care for communities. And that's something we all need to be paying attention to. I think it also add my concerns around the One Big Beautiful Bill Act, the provisions that are contained within it that are most troubling for me are those that further restrict access to coverage, and they do that through a couple different ways. The first is the work requirements and the biannual certification for Medicaid folks, for folks on Medicaid, I should say. Currently, if you're on Medicaid, you only have to recertify your eligibility once a year. That will be moved to every 6 months. And then it also requires you to verify your work history, your employment eligibility. We know that about 92% of people on Colorado Medicaid are already working, living with a disability, providing caregiver services, or a student. And so the very narrow percentage of the population that this impacted is not a huge number of Coloradans. But what this does do is it adds administrative burden and administrative complexity for everyone. So everyone's going to have to go through this process every 6 months. And what I fear is that that will disenroll people, not because they're not eligible, but because they don't have the capacity or the time or the broadband access to be able to submit that documentation. The other provision I'm really concerned about is the expiration of the enhanced subsidies for ACA plans. During the pandemic, the federal government increased the funding for people who bought their plans off the exchange. This legislation allows those enhanced subsidies to expire. And so it'll make healthcare more expensive for all of us. I think both of these things combined will only increase the number of people living without insurance in our community, in our state, in our country.
So, as I said before, Lift Up from 2022 to 2024 served 55,000 to 190,000. So this past few months, we've had to kind of adjust the way that we've done things and reel it in a little bit as far as programs and stuff like that. So we've already started working on all of that. But I do agree with Hans that it's going to be like partnership and reaching out to the community and asking for help as much as we can so that we can continue to provide food for everybody.
Thanks, everyone. Thanks, Samantha. I think just coming back to food and the other thing that we work on, another social determinant around housing for those experiencing homelessness or at risk. There's also the factor of how much food cuts are involved in, I can't call it that, I have a different name for that bill. So I'll share it if anybody wants to hear it offline. So the amount of cuts around food and Medicaid and those kinds of things, because like Dustin said, I'm a believer that healthcare is a right, housing and food are a right, and that being one of, that we should have that in our communities. And so that's the part that's a lot of that's scary for our community, for our region. However, as a lot of people have mentioned, we are creative, we are resilient, and we will need to partner together to make a difference around health access, food, and housing, and other key issues that are going to impact all of us. And we have significant challenges being in the region that we are because of our high cost of living, our high cost of housing. And so that adds another layer. So I'd love to just talk briefly and ask you guys to share how you think we can collaborate. West Mountain offers sort of this ability for us, all of us, to come together. I love seeing who's in the room and how many people are in the Zoom room, because we have a lot of really good wisdom and strength with us working together. And so I'd love to hear from you guys how you envision that a bit going forward as we face some significant challenges. Do you want to go first?
I really think that it's going to be interesting, because I think we need to avoid the potential pitfall of, kind of thinking internally first and then fanning out to, our partnerships and thinking about how we, create these continuums, these collaborations. That's going to be difficult. I think that the pitfall that I'm referencing is that every single person, entity in this room is going to be facing some kind of financial challenges, changes to how we've done things. But I do believe that we have opportunities to think maybe to work together first, and that by that our community is strengthened. And I know that that probably sounds a little idealistic, a little social worky, but I'm going to lead with that, and I'm going to kind of hopefully be the champion of that. There's plenty of people to take care of. I think we're just going to have to innovate around how we seek that funding and those partnerships so that we can continue to be a strong community.
Yeah, I think, I look around this room and I do see a lot of people that we're already working with and we already have these partnerships with. And I'm just hoping that we can all sustain and weather this storm. And we all know that it's a bubble. If you press on a balloon this way, it's just going to poke out the other side. So, it's very hard for us to really say that, by cutting Medicaid, we're going to solve some of our problems, because we all know that, that's not necessarily the solution. But I think if we can continue to keep the lines of communication open and making sure that we understand, what maybe, you need help with, what we need help with. I know that we have a great food program with Lift Up that we're very appreciative of. And, that might have to go away. And that's a pain point for our families that we've often relied on having that resource for them. So I think just continuing to understand what your limits are and what our limits are, how we can support each other in going forward.
Yes, I do think it's fortuitous we're sitting here having this conversation with the 10-year anniversary of West Mountain, because I think it affirms that now more than ever, as we look ahead, this concept of we as a West Mountain region forming an alliance, I think is going to be even more crucial. And so I think looking ahead, the opportunity is perhaps kind of that sentiment of looking outward is how can we all continue to lean in and partner with West Mountain Regional Health Alliance to not only advance our work and mission, but to really uplift the entire community. And I think West Mountain has been doing that. It's grown so much in the past 10 years. And so what can the next couple of years look like for us as a community coming together through the Alliance to address these challenges? So I think it's unique timing here.
Thanks. Happy anniversary. I guess for me right now, it's been focused on funding, of course. That's kind of what keeps me up at night, and has been always in a director's role, I'll be honest, in a nonprofit world. But I think I don't have all the answers. I'm just trying to ask the right questions. I'm also being really open to looking at things differently than and pushing on partners a little bit more to be like, what are you thinking? What are you feeling? Because I'm kind of just trying to be a good leader and also take my staff and board along in a reality, but also be thoughtful and strategic, but also be okay with doing things that are non-status quo a little bit, if that's something out of the ordinary. We've been so grant dependent and focused on contracts that maybe an event or something like that, or I mean, we just haven't had to do that before, but that's okay. And but maybe it's just another way of looking at how to tackle the same problem with a growing need. So you can't do it alone, and you have to ask for help. And so confronting that, I think, is all you can do right now. At least this is from my perspective. Yes.
I think there's a couple opportunities that I see for West Mountain Regional Health Alliance moving forward. The first is continued coordination on the data that we all have. The data that each of us manage individually can tell really powerful stories. And when we combine that and use it to understand where interventions are most effective and where the interventions that we're doing independently have outcomes in other systems, I think that helps tell the story to the state, to the federal government about where that money should be invested. I know Western Mountain Regional Health Alliance is leading an effort right now to look at social determinants of health and its impact on healthcare claims. And I think that's going to be an awesome dashboard that we'll be able to build upon for years to come. I also think that data needs to lead to advocacy of some sort. So we need to use that understanding of what works to ask for what works. And this is a completely self-serving comment, so please forgive me, but using that data in my perspective to advocate for more dollars to go into the primary care setting, to community health, but using our collective voice as an alliance to further where we see opportunity. And then I think the last thing I'd add is we've talked about some of the challenges that we're all seeing. I think it's a safe bet to say that we're going to be experiencing a tremendous amount of disruption over the next 2 to 4 years. And so just keeping our eyes open for opportunities within that disruption to see if there's programs we can advance, initiatives that we can seize that might not otherwise have gained traction a few years ago, just because everything is in such turmoil.
So I agree, partnerships and just leaning in to each other, and the more we can help each other, the more it takes pressure off the whole system.
Absolutely. Thank you all. I know this is, it's a tough topic, but it's also the timing is right. And I'm glad we have the ability to come together and have these conversations. With that in mind, I'd love to hear from people in the physical room and the Zoom room with questions or comments about about the panel and kind of what was shared. Okay. The 10-year anniversary event's going to happen at the Hotel Colorado on Thursday, October 16th from 4 to 6 p.m. It's designed for networking. We're going to show a small program or a short program because we know, and just to celebrate and get together, which is sometimes we need to be in person like today, and it's not always possible. We all are in person and not in person, but I think that's a really powerful thing. So anyone, just thoughts or questions? You've got a lot of smart people up here if you want to. Great, Annette.
Is it your understanding that with the HHS ruling that came out last week, that impacts federal funding from all sources, even the pass-throughs from state grants, and how, as an organization, would we be able to utilize private funding and continue the work that we're doing?
It's really good question. Just for folks that might not have been able to hear it, and that was asking whether or not the HHS directive from last week impacts all federal dollars or is more specific to a program. I understand it that it is program specific, and so they in the release articulate, I think, about 30 different programs that are subject to this new restriction. Named in it is the Health Center program, which is where Mountain Family receives its space grant. So I think it'll just be tied to our base grant funding, which is about 12% of our total budget at Mountain Family. What I don't know yet is how intrusive the guidance that HRSA is going to release. I have a call that I'll need to step out shortly to take, but the analysis that I've read so far thinks that there's a couple different pathways that HRSA could take. One would be a restriction on use of those federal funds for serving that community. So if someone without documentation is one of our patients, we would need to verify their immigration status, which is a whole other concern that I have. But then would not be able to sign them up for our sliding fee scale because that allocates federal dollars. The other kind of end of the spectrum, which is more terrifying, is that it would essentially be a condition of participation that we would have to verify immigration status and not provide services at all. But that's still to be determined.
Yeah, similar. It's still so new and there's some questions that we need answered because we just heard about this on Thursday. And as you know, it's very chaotic and ambiguous. I know it would be definitely for our clinic tied to Title X program funds that are stately distributed. And we've already seen a cut to that before all of this as of July 1st. So we're prepared for that, I guess, but deeper ones would be really traumatic. And yeah, that's what the scenario planning is for. Let's hope.
Thanks, Logan. And I will add, because Logan shared about the prenatal program, that was actually a brainchild when West Mountain wasn't an official organization. Nan Sundin, who used to be the Pitkin County Human Services Director, brought together people to solve that issue. And so that's pretty exciting. It does come full circle. And that was an innovative solution that continues today, hopefully, with all of the changes. Other questions or thoughts that you'd like to share?
do we know what the changes to WIC are? And I think that program is so supportive to so many in the perinatal population, whether it's or just human support.
Yeah, and WIC isn't ran out of the Department of Human Services, it's ran out of the Department of Public Health. And so I don't have like specific information related to WIC, but from my understanding with our public health partners, that there's been a little bit of a carve out in that WIC isn't being specifically targeted or affected right now. I think that as indicated by the panel, there's a lot that needs to be kind of digested and picked apart. And again, as Bill indicated, just understanding that, I mean, it's a lot of vague language that's getting right now. And so, understanding the language specifically and what that looks like, when it comes down to programmatic type of decision making, we don't have a lot of that. So, but yeah, as far as WIC is concerned, I'm, that's heard it. And I'm missing Christina Dolan. Is she on our, is she on?
I don't know if Christine is on. Christine, if you are on, let us know. Yeah, and I think I just want to repeat it in case people couldn't hear it online, but the question was around WIC and how that's going to impact the people who are part of WIC. And right now it seems to be a carve out, but again, there's uncertainty around that. And in our WIC is handled by public health in our region. And so, yeah, more to come. As we learn things, we'll certainly share them and try to keep the group updated. It's a day-by-day change. Anyone online have a question or comment? Okay, thanks, Karina. All right. Well, I just want to close out and thank the panel for being willing to be up here and on, it's a pretty easy hot seat. It wasn't too hot, right, Hans?
It wasn't too hot.
A little bit. Yeah, what life is fun. But
Close out.
yeah,
Yeah, please.
thank you.
Given that I'm with the Department of Human Services and a lot of these changes are, that within our world, what I can say is that the state is very proactive and there is a lot of conversation that's going on at this particular point in time to address, all that is coming down, through the feds and to, work groups being established. And it has as everybody has indicated up on the panel, just a lot of innovation and challenging the way that we've always done things and just coming up with different ideas on can this potentially look a little bit different moving forward. And so although there is a lot of anxiousness and around all the changes that are coming, it could also offer, as somebody said up here, opportunities too, where potentially funding hasn't been exactly targeted in the past. And does that give us an opportunity moving forward, to look at funding in other areas that hasn't always been supported. And so, we don't know a ton. There's some changes that are coming into effect as early as October of this year in relationship to our food assistance programs. And then other changes, again, as one of our panel members had indicated, it's over the course of the next couple of years. And so everything won't happen tomorrow. It's going to take some time just to absorb all the changes and to just to figure out what it does look like. And as far as some of the work requirements go, there are work requirements that are going to be created within Medicaid, but then also within food assistance also. But there's some, those are for particular populations. So not everybody on Medicaid is going to have to verify work requirements. There is a certain population that will need to do that in the same way with food assistance. So, you know, just stay tuned and, you know, trying to get the correct information out, you know, and you know, making sure that, you know, we don't move into more of a panic mode and just looking for, you know, different opportunities to be able to, you know, just challenge ourselves from the way that things have always been done. So I just wanted to add that too before we closed out.
Thank you, Sharon. That's a really good point. Our state is trying to find innovative ways, and we're fortunate for that. I think just to close out, I just want to say that together we're better. I use that term a lot, but we are, and we'll have to weather the storm. I think it was Stacy when we were talking recently, and she said, we all got through a pandemic, so we will get through this as well.